Yeah, so recently there's been a lot of discussion about a new condition. It's actually an old condition that we've kind of resurfaced. It's called LAL deficiency, or lysosomal acid lipase deficiency. So what is it? It's a condition in which the liver can't process cholesterol esters correctly. So either because of the food that we ingest that has cholesterol, or as a consequence of the body recycling cholesterol, it comes back to the liver as cholesterol esters. Those esters have to be broken down into free cholesterol for the body to use it once again. And therein lies the problem. They don't have a digestive enzyme within those lysosomes in order to do so. As a consequence, two things happen. One is the cholesterol levels will go up. Again, in most of our experiences, that looks like it might be familial hypercholesterolemia, so our inclination is to treat these with standard drug therapy, including statins. The problem is that cholesterol ester is trapped inside lysosomes, and those lysosomes reside in the liver. And as a consequence of all this cholesterol ester, that cholesterol ester is going to cause damage to the liver, and ultimately it's going to cause scarring or cirrhosis. So these people get into serious trouble with liver failure. Interesting enough, the therapy that we offer to lower cholesterol, statins, may actually make that condition worse, because what they do is upregulate the LDL receptor, cause more cholesterol esters to be incorporated into the liver, but they can't go anywhere. They don't have an enzyme to digest it. So there's new and promising therapies on the horizon. We hope that that'll be FDA approved sometime in the near future, and it'll be safe and effective. But it basically is replacing the enzyme that's deficient. And as a consequence of that, hopefully the liver function studies will normalize. Short-term studies up to a year, we've seen dramatic improvements in liver function studies as well as the cholesterol level. So stay tuned. I think lysosomal acid lipase deficiency may be something on everybody's horizon here in the near future.
We've got two presentations and a poster at the meeting. The first presentation is the results from a phase 3 study, which is a double-blind, placebo-controlled study in both children and adults with lysosomal acid lipase deficiency. The second presentation is a phase 2/3 study in infants.
For those of us who see children, pediatric patients, lysosomal acid lipase deficiency is really very important. About 90% of all the cases that have been diagnosed to date occur in children. So this is primarily a pediatric disease. So the question is, if I'm a primary care doctor, if I'm a family practitioner, or general pediatrician, or maybe pediatric cardiologist, what am I going to look for? How will I know what this is when I see it? I think it boils down to three very simple things. The key to me, and I'm a lipidologist here, but the key to me, first and foremost, is hypercholesterolemia. I want to look for high cholesterol. And in kids, of course, we want to do kind of the age-corrected thing, and for a young child, it doesn't have to be that high to be really, really high in terms of percentile. But if we have a significantly elevated total cholesterol or LDL cholesterol, then that's key number one. And we're focusing on this familial hypercholesterolemia thing. We're trying to screen the kids for that. We're trying to do cascade screening of the family, the whole thing. That's wonderful. But realize that whenever you see somebody with what looks like familial hypercholesterolemia off in the corner, you need to remember, could this be LAL deficiency masquerading as the typical case of FH? So the first piece, elevated LDL. Second piece, low HDL. Now HDL tends to be just a little bit suppressed in FH, but it tends to be even a little bit lower in the cases that truly have LAL deficiency. So high LDL, low HDL. The third element here is elevated transaminases. The liver is hit very hard by this, and you look primarily with elevated transaminases. Now, if you're good at a physical exam and the patient will relax for you and you can get a good liver exam, you're going to look for hepatomegaly. Virtually everybody with LALD has a big liver. And in some ways it's a little easier to pick up in kids than it is in adults. But I think the transaminases are actually even a little bit better than hepatomegaly, but look for both. Okay, so you got those three elements. If you see that, then you say to yourself, this might be that rare disorder, LALD. So then what do? You have your choice either to send out to your local clinical lipidologist. There are pediatric lipidologists around the country. A lot of us that are in adult medicine that are clinical lipidologists will actually see children as part of our practice. So find one of us in your community and or somebody else in the National Lipid Association or just somebody else knowledgeable about lipids primarily or liver disorders. And then we'll do the screening, but you can do it. There are actually kits available. It's a dried blood spot. Send it off to the lab. It is free of charge. There's a kind pharmaceutical company that is paying for us to do these screens, so it's free. Can't get better than that. And it's completely definitive. There is no overlap whatsoever between normal and LAL deficiency. So we know for a fact if they have it. If they do, then we for sure need to refer off. And if they don't, then we go on our way. So, to me, the most important piece here, this is a rare disease which is way underdiagnosed, way underappreciated. If we miss the diagnosis, and it's picked up 10, 15, 20, 30 years later, then all that damage has occurred and the patient is way worse off than if we had thought about it when we had that chance. So as we screen our children for lipids, let's remember the high LDL, the low HDL, and then that transaminase piece that really doesn't belong with the other two if it's a standard FH case, or the hepatomegaly and or those two liver pieces don't belong with the other. That tells us refer for screening or screen and then refer if we make the diagnosis.
My name is Mark Goldberg. I'm the Executive Vice President for Medical Regulatory Strategy at Synergy Biopharma. We're studying lysosomal acid lipase deficiency, which is an autosomal recessive disease due to mutations in both alleles of the gene that encodes lysosomal acid lipase. This enzyme is critical in cholesterol metabolism. When an LDL particle binds to the LDL receptor and gets taken up by the cell, the cholesterol esters and the triglycerides within the particle are hydrolyzed within the lysosome into free cholesterol and free fatty acids. And when this enzyme is deficient or absent, there's a dramatic increase in the amount of lipids that accumulate in the lysosomes of the cells throughout the body, but particularly in cells of monocyte macrophage lineage and hepatocytes. This leads to progressive accumulation of fat and steatosis in the liver, usually microvesicular steatosis, so that progresses to fibrosis and cirrhosis, and leads often to liver failure, even in childhood. There's also a dyslipidemia marked by a high LDL and a low HDL and a variably elevated triglycerides that leads to accelerated atherosclerosis.